Professional policy analysis in town is so critically important. We don't have enough of it. We got too many think tanks and not enough thinking guiding a lot of direction. Bob Greenstein is the founder and president of the Center for Budget and Policy Priorities, very carefully named Center for Budget and Policy Priorities, because they go together. And he has, from his time in the Carter administration in the 70s, been an unflinching advocate and defender of a robust and functional social safety net in this country. In the 70s, for Carter, he was the head of the nutrition program, leading to very critical reforms that in the decades to follow became known as the food stamp program. So Dr. Greenstein was, Bob Greenstein was always referred to as the prior egg committee chairman when I came to Congress as Dr. Food Stamps instead of not Dr. Green Stamps instead of Greenstein. That was a Kika de la Garza improvisation. Well, he's here today to provide analysis that I think you will find once again is true to the mark. Through the years, Bob and the Center for Budget and Policy Priorities brings forward fact-based analysis. And whether you agree with what his policy is or whether you disagree, you're going to have a hard time pulling apart the numbers behind them. It's always believed that facts ultimately ought to guide where we go from here, not belief and facts, belief supported with facts. And so that's the kind of analysis we're about to get for our luncheon speaker. Please help me welcome Bob Greenstein, Center for Budget and Policy Priorities.
Thank you, Congressman Pomeroy, for that kind introduction, and thank you for the work that you and Congressman McCrery are doing in spearheading this project. Good afternoon, everyone. The need to replenish the DI Trust Fund gives us an opportunity to improve DI and better serve people with disabilities. But given the population DI serves, any changes in it need to be made with great care. With that in mind, I'd like to offer a few introductory thoughts and then turn to a few key issues. First, I have to say I am disturbed that in the current debate, some misguided attacks on DI have emerged. For example, some portray DI spending as wildly out of control. Yet the majority of the rise in the disability rolls stems from straightforward demographic and other factors like the aging of the baby boomers, the growth in women's employment, and the increase in Social Security's retirement age. Take the growth in women's employment. It has substantially increased the number of female DI beneficiaries, and we should regard that as good news. DI applicants must have a significant work history, and until recent decades, until women joined the workforce in large numbers, relatively few of the women who were seriously disabled could qualify for DI benefits. There used to be about 2 male DI beneficiaries for every 1 female DI beneficiary. Now men and women are equally likely to be eligible. It's not that women weren't disabled before, it's that they often didn't have enough earnings in the paid labor force to qualify. In addition, now that the economy is growing and the baby boomers are moving from their peak disability years toward their peak retirement years, significant DI cost growth has essentially ended. DI's actuaries project the DI benefit costs have reached their peak as a share of GDP and won't rise further, unlike Social Security retirement costs, which will continue rising for some time. We also shouldn't forget, I'm sure people in this room don't, that DI benefits are modest. The average disabled worker receives $1,165 a month. That's about $14,000 a year. And that's only a little over the poverty line. It's less than the average Social Security retired worker or aged widow receives. And as a result, 1 in 5 disabled workers are poor, roughly double the rate for others their same age. Now, we often hear it said that it's easy to get DI. Just claim your back hurts or you're suffering from anxiety. As I think everyone here knows, you must have a serious, medically determinable impairment and a considerable work history, and you must pass a recency of work test. Evidence of your impairment must come from acceptable medical sources, backed up by clinical findings, and the opinion of one's own doctor is not sufficient. I think it's interesting that according to the OECD, the United States has some of the most stringent disability criteria of any advanced country. And a fact I find surprises people when I mention it to them, not people in this room, but people who aren't in the middle of this. Only about 4 of every 10 DI applications are approved. If accepted, beneficiaries are subject to periodic reviews to verify that they're still disabled, a practice that we should strengthen and tighten by providing more resources for the periodic reviews and making sure they are done on schedule. Some critics argue that the 1984 DI changes made eligibility lax or highly subjective. But the '84 legislation essentially ratified reforms that were already underway through regulation and the courts after an overzealous crackdown had ended or denied benefits for hundreds of thousands of people, many of whom were, in fact, disabled. The '84 law directed SSA to weigh the combined impacts of multiple impairments, publish new standards to evaluate mental disorders, and document medical improvement before ending benefits. But it did not expand the definition of disability or relax the requirement that applicants provide substantial medical evidence. Congress passed it unanimously, and the Social Security actuaries judged it would have only a very small impact on DI's financial outlook. Let me turn now to a few key issues, starting with the issue of work. DI provides various incentives for beneficiaries to work. As you know, they can earn up to $1,090 a month and still collect benefits, which for an average beneficiary would nearly double his or her income. But only a minority of DI beneficiaries ever work again, and just 4% work enough to work their way off, earn enough to work their way off DI. In most, though certainly not all, cases, that's not because DI lacks work incentives. It's mainly because of the severity of beneficiaries' impairments. DI beneficiaries are about 3 times as likely as others their age to die, another indicator of poor health. What I find particularly telling is that even applicants who are rejected for DI because they're judged not to be disabled enough don't work much after they're rejected and fare poorly in the labor market. Barely half of them have any earnings 2 years after they're rejected. And among those who do have earnings, the earnings tend to be low. When policymakers discuss broader Social Security reform, they almost invariably assure the public that any changes won't affect people who are at or near retirement, often defined as people 55 years of age or over. That's because people need time to plan their work, saving, and retirement. But disability beneficiaries are far less able than retirees to change their behavior in response to benefit or eligibility cuts or changes. Now, this is not to say that we shouldn't endeavor to improve DI so that people with disabilities can work to the full extent they're able. Policymakers should try to improve work incentives. I just want to note that our desire to make advances here exceeds our knowledge of how to do so successfully. We have a lot to learn about what will work. And I fear that some policymakers think they already know the answers, when in fact they and we generally don't. Let me give you an example. One widely discussed proposal would replace the DI cliff with a ramp in which benefits shrink $1 for every $2 of earnings once earnings pass a certain threshold. Now, if you applied the 1 for 2 at the $1,090 SGA threshold, that obviously would create an incentive for beneficiaries to earn more than that amount. But as we all know, that would also raise DI costs. And to prevent that, some proposals would start the benefit offset at a lower threshold of earnings, possibly as low as $300 a month. Now, doing that would create a new work disincentive for those beneficiaries who have earnings between that lower threshold and the SGA level. They would face a 50 percentage point increase in the marginal tax rate on their earnings, reducing their income and making work less attractive, and that's no minor concern. A recent study found that about 11% of DI-only beneficiaries worked in 2011, and 70% of them had earnings under $10,000 a year, 40% had earnings under $5,000. So under this proposal, individuals with earnings in that range who couldn't work more would face substantial income losses, and in some cases, they would fall into or deeper into poverty. Now, the proposal is designed to increase work, but it's not clear whether overall work would increase or decrease under the proposal. Yes, some people clearly would work more, but others who would face a 50 percentage point increase in their marginal tax rate may well work less. And the proposal would, on average, shift resources from sicker people to people who have less severe impairments and can work more. Now, given that a clear impact of the proposal would be some increase in hardship and poverty, while we don't know which direction the net change in work would be, in my view, it wouldn't be responsible to institute such a change without testing it first. Only a demonstration project can show us whether the net effect on work would be positive or negative and to what degree. So to me, it's disappointing that some of the same policymakers who admirably promote the need for evidence-based policy in other spheres now favor instituting this policy without testing it first and gathering the evidence. Let me turn now to the issue of reallocation. As we all know, no plausible set of DI changes can avert the need to shift resources from the retirement to the disability fund in 2016. Congress has reallocated payroll taxes various times over the years in both directions with bipartisan support. But this time, some policymakers and opinion leaders almost seem, at least in some of the rhetoric, to be trying to pit retirees and people with disabilities against each other. They describe reallocation as a raid on the retirement trust fund that would hurt seniors. So I just urge all of us to remember that the last two reallocations in '83 and '94, essentially you could say that they shortchanged DI by underfunding it compared with the retirement program. No one called that a raid on Americans with disabilities at the time. If DI's tax rate had stayed at its pre-'83 level, we wouldn't need to replenish DI today. The '83 legislation disadvantaged DI in two ways. It shifted some benefit costs from OASI to DI when it raised the retirement age, even as it reallocated revenues from DI to OASI. Now, it did it because OASI faced imminent insolvency in '83. But nevertheless, we should recognize the history as playing an important role in getting us to where we are today. Moreover, the implication in some of the rhetoric about a raid is not only that reallocating funds to DI would be a raid on seniors, but that Social Security essentially has one program for truly deserving beneficiaries, the retirees, and another program in which many of the beneficiaries may be less deserving, DI. In reality, with the physical and mental conditions that people with disabilities face, they often have harder circumstances than retirees. The percentage of DI beneficiaries who can work is almost surely lower than the percentage of retiree beneficiaries who could work if they had to, and a larger share of DI beneficiaries than of retiree beneficiaries are people of color, many of whom face discriminatory barriers at various points in their lives. So please, my plea is, let us not imply that DI beneficiaries are a less deserving group or in any way try to pit seniors and people with disabilities against each other. Seniors, people with disabilities, and today's workers all share a common interest in ensuring the long-term stability of all of Social Security. So this brings me to calls to rule out reallocation and instead to loan funds from OASI to DI. In my view, that would be ill-advised unless DI also is provided the resources to pay the loan back, which such proposals invariably do not do. Here's my concern. A loan would dig a deeper hole for DI, and my fear is that it ultimately would lead to rhetoric and even potentially some demagoguery about what would be said to be DI's enormous debt, and attempts to foster the impression that elderly beneficiaries are being ripped off by a DI program that is unable to pay its debts and that might even start to be portrayed as the grease of social programs because it can't pay its debts. Given the way political rhetoric runs these days, I don't think this is an idle concern. And I fear that that could set the stage for quite harsh DI changes down the road, despite the severity of the impairments of many people. So this is why I strongly believe that we should combine reallocation with measures to strengthen program integrity and to mount demonstrations to find ways to improve DI, but that legislation that requires interfund borrowing instead of reallocation should not be acceptable. I think that the risk to people with disabilities down the road is simply too great under that course. Lastly, let me talk for a moment about demonstrations. There's an array of interesting ideas to help people with disabilities and to strengthen DI, many of which are being presented at this conference, why you're all here. Promising new ways to promote opportunity for current or prospective beneficiaries deserve to be tested. We could test simplified work incentives, early intervention services, and other items, again, that you're discussing throughout the day today. We should have realistic expectations, however. As you know, in the past, SSA has tested various ways to boost work that have produced limited results or not proved cost-effective. It's simply that we shouldn't expect, or lead policymakers to expect, there's some silver bullet out there. We're just going to find the silver bullet and everything will be easy. And as you know, demonstrations take time. Now, everyone in this room knows that demonstrations involve site selection, staff training, creating an experimental group and a control group, dealing with things like sample size. Demonstrations have to run long enough to establish validity. People often respond differently to temporary versus ongoing incentives. And participants have to be tracked long enough to verify whether results are temporary or persist. In short, we want demonstrations to produce results that can guide policy that could affect millions of people for decades to come. But to do that, the results need to be reliable. And I think that means that it's important that members of Congress not think that carefully designed, well-evaluated demonstrations are going to produce these kinds of results in just a very few years. We need to educate members so they allow the time needed for important demonstrations to yield reliable results. In conclusion, Americans with disabilities face significant challenges, not only in returning to work, but in living with dignity and independence and figuring out how to improve their lives, and in the context of the DI program isn't easy. So I commend everyone who's here today, and Congressman McCrery, Congressman Pomeroy, Ed Lorenzen, Mark Goldwine, and others for your work to advance our understanding of these quite important issues. Thanks very much.